So the intention of today's call is just to be able to create almost a little bit of a question and answer dialogue that I thought might be helpful to some of the parents who identify more with the idea or the word holistic.
Mm-hmm.
In no way is excluding other parents who are interested and curious about what we're doing, but there is definitely a subset and population of patients who are looking for solutions that feel more natural or feel more holistic. So just diving into that today.
Yes, and if you're curious at all about what that means, this is definitely for you, because the term holistic can mean so much in our heads, but truly holistic just means you are patient-centered. You're looking at everything being connected, and that you can't affect one part of the body without it having an effect somewhere else. We just don't always make that connection. And when you make that connection, you realize, oh, there are so many things that might help this area, but then negatively impact another. So how can I do this where I positively impact the root cause and it has this great cascade throughout everything else? Because if I address the root cause, I can make that cycle go positive instead of that cycle go negative.
Yeah, perfect. That's a great way to kind of explain what we're after here. Going into this kind of airway community, my feeling is that most people are here because of their personal experience and because of a drive to help more parents. Do you want to talk to me about some of the feelings and what you went through as you entered this space?
My father's an orthodontist. So dentistry was just what I grew up with, and his father's a dentist, was a dentist. Yet I didn't really feel connected at continuing education programs. I was very much taught to be part of organized dentistry, which I still am. I will still promote organized dentistry. But then I would go to these large meetings and I would kind of sit in the back, and I didn't feel connected to the speaker. I didn't feel connected oftentimes to the crowd. I wanted to go in, learn, and go to the next class.
Yeah.
Whereas now, because this community, we don't just know the facts, we understand the effects and how it feels. And when you're no longer doing just technical things, you're not going to just learn how to do X, Y, and Z better. You're going to learn how to actually help transform their health.
Yeah.
It makes such a difference, because then you realize, and it's true with all of healthcare, right? There's really no competition. The competition is all based off of all the other distractions there are in life.
Yeah.
And everything else that's saying, spend your money on this, that your health isn't worth spending money on, but go spend $1,000 for this face cream.
Right.
And if $1,000 face cream could make us healthy, great. Except that's just a Band-Aid for all the other things that are going on.
Absolutely.
So we get together and we can actually share, because no patient's alike. Once you have a patient that wants really root cause care, there is no competition.
Yeah, for sure.
So how I came about this was, initially I was getting very frustrated with my orthodontic continuing education courses. I even went to what's considered the best of the best, and I asked my questions. And one of my main questions was, I have all these patients with tongue thrusts. My dad really was the impetus for me really seeing this. My residency didn't spend that much time on tongue thrusts, which reverse swallow is also another term, the term that he would use. And why, I don't know why I have all these patients with tongue thrusts and impacted second molars. So the 12-year molars, not the wisdom teeth, those are your third molars. The 12-year molars weren't able to come through.
Interesting.
Why am I having these patients? And I wasn't getting the answers. So then I was at a dental leadership conference where another orthodontist, long story short, basically said to me, I wasn't doing enough for my phase 1 patients, or my interceptive care patients. I said, I don't think you understand. I actually really like phase 1. there's few of us that actually want to do it.
Mhm.
And I do it well. She's like, yeah,
Mhm.
but you're not doing enough. And
Mhm.
that stinks. Nobody wants
Just
to hear that.
Yeah, just to clarify, so phase one, we're talking about early treatment, right? Younger
Yes.
individuals. Okay.
Yeah. So thank you for those that have either primary teeth, so baby teeth, or primary baby teeth and some adult
Okay.
or
So you were
big kid
told you
teeth.
weren't doing enough for these younger kids that were possibly
Yes.
needing care. And okay. How did
But I was
that land?
treating them. I'm like, but see, I actually treat them, and so many orthodontists don't want to treat them at all.
Mm-hmm.
Well, that was on the weekend. I was back in the office on Tuesday. And so I emailed Dr. Yulia Pinskaya. She's phenomenal, but she sent back all this information for like courses that were over $10,000 somewhere in Australia. I'm like, are you wackadoodle? Like $10,000 for a course going to Australia? And now I've taken that $10,000 course. I have not gone to Australia for the training, but I've taken their training here. So I checked my ego at the door and I took a myofunctional therapy course. I was pregnant. So things were already kind of going through. And then my son was born, and I had waited what felt like my entire life to be a mom.
Yeah.
And then he didn't sleep and he didn't eat. He hated tummy time. And when I addressed his pediatrician and asked, well, he's got this noisy breathing, she said, you're a geriatric mom who worries too much. Go home and enjoy your child. I'm like, well, shoot, that's what I want to do. But
You're
there's
like,
all
I
these
would
things.
gladly be there if I could. Oh my
That's
gosh.
what I want. That's what I need
Mm-hmm.
help with. So to fast forward to when he was able to sleep better,
Mm-hmm.
and I was rocking him one night, I realized that she gave the best answer she could,
Mm-hmm.
just like when I answered questions about teeth grinding. And I
Absolutely.
still recall the mom that came in
Mm-hmm.
when I was working at a pediatric and orthodontic practice. She'd just come from the littlest one. I think she was either 3 or 4. And the brother was in my chair getting treatment. And she's like, well, I really want to ask you about her teeth grinding.
Mm-hmm.
And I said, your standard dental answer.
Yeah.
Oh, transitional dentition. But she was 3 or 4. So she had all of her baby teeth.
Mm-hmm.
Stress, your textbook dental answer,
For
because that's
sure.
what I was given.
For sure. And you think you're prepared
Yeah.
for that. You think, oh, okay, I have the answer for you. Just like ask away.
So when I realized as I'm holding my baby that I struggled to get the answers for,
Mm,
oh, shoot, I gave that same kind of dismissive answer to moms as well.
others.
And so what am I going to do? How can I make a bigger difference? Because as a practitioner, I only get to work with so many, right?
Mm-hmm.
So I shared my story through a picture book for moms so that moms wouldn't feel so alone. Because it was, for me, it was a very lonely time
Mm-hmm.
because I didn't have a lot of other people saying, yeah, let's have you look for other answers. Because what seemed
Absolutely.
easy was listening to the, well, it doesn't matter.
Yeah.
Just give the
Yeah.
bottle. It doesn't
Right.
matter. So yeah, there was that guilt of, oh, Yulia was right.
Mm-hmm.
I wasn't doing as much as I could. I was doing enough for at the time because that was
Yeah.
what I could do,
Mm-hmm.
but there was more. And
I
that is
think,
something, to be honest, as a practitioner, we should at every single day be just that much better,
mm-hmm.
just that much better. And each time that we're seeing a patient, we're doing the best that we can. And we just need to make sure that the education that we get is supporting us of getting better rather than just education that's like patting us on the back.
Right. Right.
Like you did really great with that, but also you are already really great with that. So why you keep getting the same course that's going to tell you you're really great in that aspect?
Yeah.
You need to be challenged And that isn't something that's talked about a lot. It's talked
Mhm.
about like, you just keep being great at this one thing, except you're never asked for just one thing.
That not in the holistic perspective, it's right. There are people, specialists who
That's
hone in
true.
on sort of just one thing. But yes, no, I think what you've shared is so valuable and so important, because I completely relate with what you're describing. I mean, I'm a general dentist, I'm not a specialist. And my journey, I mean, I still think about patients from the family practice, the first year out of dental school, where they were asking questions about similar clenching and grinding. And
Mhm.
even when I detoured to join a biological dental office, Wrigleyville Dental, where
Mhm.
you're now a part of that team as well, I was humbled on one of my first days there by one of the dental assistants who said, "This kid's tonsils are very large. You should look at that." And I was routine textbook. Kids have larger tonsils when they're younger. Just routine
Mhm.
answer. And all of the things that down the road, I wasn't looking for signs of malocclusion. I wasn't looking for signs of mouth breathing. There is an absolute evolution to our journeys into this
Mhm.
space. So I think it's really important. I appreciate you sharing kind of your story with that, because I think it's an important thing, not to make parents lose trust in
Mhm.
in the providers that they're seeking, but to understand that, especially in this airway community and people who have gone on to try and take that more holistic look, that there's great effort and intention that goes into trying to reach it. And so it gives me a greater sense of camaraderie and trust with the providers
Mhm.
that are in this space. Like you
So
said, with
what
the dental community and the meetings that you would go to now, it's different. When you attend the meetings, you do feel a greater connection and you are where you are meant to be.
so what I tell patients now
Mm-hmm.
is that the dynamic gets to shift, because if you're in an office, and I'm very bold,
Mm-hmm.
so if there are providers also listening to this, you can email me, because I would love our discussion. But if any provider says, I am the expert of what I can do for you,
Mm-hmm.
or in any kind of a rough way like that, where they're not including you
Mm-hmm.
and your input as part of their treatment plan,
Mm-hmm.
consider that.
Yeah.
Because any of us, any provider shares a very short period of time with you and your child.
Mm-hmm.
You spend every day. So we have to help each other, because there's going to be things that you don't notice because you see them every day,
Yeah.
and things that you think, well, of course they have to have that habit because that's what they do all the time.
Mm-hmm.
Whereas I'm like, oh, well, that actually can be a sign of other things, but you're
Mm-hmm.
just so used to it. But
Mm-hmm.
also, I see them for a very short period of time, and they could either be behaving really well because they're in my chair,
Right.
or they can be behaving not great because they're in my chair. You know how they behave every day. You know how they behave in the
Absolutely.
morning versus afternoon,
Mm-hmm.
evening. So the key to providers, because once you've been humbled enough
Mm-hmm.
to understand that you asking questions is being an advocate
Mm-hmm.
and not a barrier to treatment, that everything that you're advocating for is to then help guide that treatment plan.
Absolutely. I
That's
love
what you're
that.
looking for. But we have to accept that humbling process as a provider.
Mm-hmm.
And some don't. So then
Mm-hmm.
you get to pick if that's what you want to go for,
For sure.
or understand there's plenty that have and have realized, oh, okay, yes, I
Mm-hmm.
can now incorporate your answers to this into my thinking. And
Absolutely.
I am here to help your body heal, because your body is ultimately the healing mechanism. And
Mm-hmm.
I'm just here as a guide.
To enable that. Absolutely. Absolutely.
So that was kind of long, but it is really important as a parent, because it took me a while to get out of that safe of like, oh, but this is the best pediatrician in the area, and I went to the best hospital.
Mm-hmm.
but those rankings aren't done by moms.
Yeah.
Those
And the
rankings are done by other things.
Absolutely. The personal experience for every family. I think that's one of the most important factors is there is no single best treatment. Every child is going to have a different experience and background and path ahead of them that's the more aligned path for them. And yeah, I think that that's really helpful. Thank you for sharing. Well, going into another kind of question area, I wanted to talk to you a little bit about the sort of allied health professionals. So as kind of you and I are both dentists, we know that working with a holistic mindset involves being part of a more collaborative team. Would you care to share some of the other health professionals that you rely on and how that contributes to the more holistic perspective?
Well, I just had this conversation with somebody that views healthcare from a very business standpoint yesterday. And it was very clear that dentists, we learn as we evolve how to better write referrals when we're referring our patients. Oh, I can't do this procedure, but the specialist in dentistry can do it. An endodontist that does root canals, periodontist that takes care of the gums. We are very timid as a profession to then go outside of our scope of our dentistry colleagues and how we then ask for help. We kind of put it on the patient because we're not taught how to do this. So unfortunately, we put it kind of onto you like, oh, well, you know, your blood pressure is really high.
Go talk to your doctor. Absolutely.
Yes.
Absolutely. No, you're so right.
Doesn't have that communication. And so it's really a disservice to everyone involved because just because something is in the mouth doesn't mean it is a problem for the dentist to solve. The mouth is the mirror of your overall health. Dentists, we are trained to work on many things that occur in the mouth, but not all of them. And we get to work with and learn how to better work with other professionals routinely. I love my chiropractors. I love my craniosacral therapists. Love, because again, from my specialty, myofunctional therapists, which can include a range because myofunctional therapists can either be dental hygienists, speech language pathologists. We're having some OTs, which is occupational therapy, some physical therapists. Other dentists also are now taking that on fully. Those are my go-tos. And then there's so many others. There's the energy medicine workers, acupuncturists. Of course, a pediatrician, you want to keep them in the loop.
Absolutely.
But learning to talk with them. And so we still are having to use you as the parent and patient a little bit to help with that communication because this is a big shift. Dentistry isn't used to how to communicate. We would just say, this is alarming, go see the ENT.
Absolutely.
And wouldn't be able to really communicate with, okay, so I'm seeing this. And yes, at this age, like you said before, tonsils can tend to be larger at this age.
For sure.
However, I'm also seeing this, and this.
Yeah. And I think that's so important too, because that's oftentimes how these other providers, if they aren't attuned to what we're looking at, how they can have their own sort of professional awakenings in some capacity, because otherwise we do sometimes just get the parent who comes right back and says, oh, there was no problem, you know? And so being able to be a more proactive advocate for the parents who have come to us and trusted us to help their child's health. So I think that that's a really great message that you shared. Thank you.
And I'm going to add to that with sometimes when we do have to put things on to the patient and parent, it's for the benefit of everyone because pictures, such as if we're concerned about their sleep, little snippets of recording your child, how they sleep or how they eat or how they breathe while they're, you know, watching TV or reading when you're reading them a book,
Uh-huh.
that is worth 15 minutes of conversation and
For
half hour
sure.
of trying to write a clean, detailed referral.
Mm-hmm.
You show this picture and say, I have this concern,
Mm-hmm.
and it's showing up also here.
Absolutely.
And that's something, as being a parent advocate,
Mm-hmm.
this isn't another thing to add to your list. This will actually make this communication not be a battle of, this is my field, this is your field. It'll help connect, because this driving force,
Mm-hmm.
like what you said, Dr. Julia, this is all because we have had this personal, and it's really comes down to the parent, because it's the caregiver is also the provider.
Right. But I think that that's an accelerated part of getting parents to the result, to answers quicker, because you can type out in a report, this child reports snoring, and that can be easy to read on a page and go right through it. But when presenting with a video of maybe what we thought was snoring, but might be more of actual kind of pauses in breathing or more severe incidents, that's going to just accelerate the receptiveness of, oh, we really do have a problem here. Let's hopefully try to unpack that for the team. So yeah, that's great. And I've heard you say before, I know you said you paused on your myofunctional therapist for a brief moment, because as an orthodontist, that's one of the most essential tools for you. I've heard you say before, if choosing somewhere to start, you do tend to, if only one part is going to be a first step, you do tend to promote myofunctional therapy. Can you speak to that for just a moment?
Definitely. So when there's concerns,
Mm-hmm.
everyone plays a role, but myofunctional therapy, because you're working on changing the programming of how you're using your muscles, you actually want to create these new relationships of what your head wants it to do and what your muscles are going to do. Myofunctional therapy is so integral to this, because they can also be the quarterbacks. They not only are doing exercises, they're really doing reprogramming of the brain along with your child. And the 4 goals are incredible goals, and understanding that the myofunctional therapist alone is going to need support to get there. So the myofunctional therapist alone should not be responsible for all 4 of those goals to be achieved, but then they can help quarterback and can help realize, okay, so now is a great time if you want to really have enough room for your tongue, orthodontics, rather than kind of working backwards of, here, my child is coming in, narrow jaws, crooked teeth, to the orthodontist. And then saying, okay, let's go do myofunctional therapy. Let's get the child really understanding that this nose is supposed to be used, because that's one of the goals, is nasal breathing. The lips should be together, especially while eating. Lips together at rest is another one of the goals. The other goal that is just not really understood is the tongue posture, because people don't think about that.
Absolutely.
And then you can think you have really great tongue posture, your tongue being up to the roof of your mouth when you're not speaking, eating, talking. It should automatically just want to go up there. And you don't know until you have proper tongue posture what it really is.
For sure.
And then proper swallow.
So
myofunctional therapy, and I think what is really key to me saying this as an orthodontist, because it's like, well, isn't that your job? If you only have the finances to do one, do myofunctional therapy.
Yeah, as an impact. So I've seen before and after photos that were very impactful from myofunctional therapists, and cases where if you start in a child who's young enough, it looks like they've had orthodontics, right? I mean, the natural balancing of the forces of the face between the lips, the cheek, the tongue, that is often, if it's out of balance, that's often one of the drivers for having malocclusion in the first place. So it can be a very impactful to start it if choosing. But again, like anything, we both always kind of acknowledge that each family and the parent perspective is going to come into that to play as well. I know in the case of my niece, I was like, you guys should do some myofunctional therapy. And my mom's like, here's an expander. Like there's limits to what everyone's experience will allow, and finding the right path for them. But I think it's really impactful to hear from you, an orthodontist, saying the extreme value that myofunctional therapy can have for sure.
And I would like to add to that, sometimes with what the patient's presenting and also what the parent is having stress about, there are times that things such as having tonsil ends out first, sometimes that's what's best.
Yeah.
You can have these, there's practitioner arguments about
the order of
done
operations
first,
kind
right?
of. Yes.
And it's really an argument that doesn't need to happen because you need to look at that patient and that family. I mean, if you have a family that says, no, like those are large tonsils and adenoids, they have to be out. They have to be out. Like I can't let my kid not sleep, which means I don't sleep one more night.
So finding what's right and what's aligned for that parent and their peace of mind moving forward is a huge part of the for sure.
Because they've been so sleep deprived. They're like, oh my gosh, if there's a way that I can get him or her to have better sleep right away, let's do that. And then follow the other protocol later. It's just key that it is important to stress that no one of these modalities alone is going to give the end result.
Complete resolution to the problem. Yes. Absolutely. That's important. Thank you for sharing that.
And I share that because a lot of times then I think some caregivers come back and they have some guilt about, oh, well, I got this done because it really felt right at that time. And then I was told I shouldn't have done that. If you truly feel like that is what your child needed, then it's time to let go of that guilt, because whatever they said,
you took the right step for you in that moment. Absolutely. Thank you. Looking at some of the more natural ways to treat. So when I say that, a lot of the controversy comes up with things like rapid palatal extensions. And the question of like, is that the most natural way to treat a patient versus other options? We'll talk a moment maybe about the ALF, or some of the preformed myofunctional appliances, and just talk about kind of the rapid versus the slow, and who might be the right population where you need to consider doing things a little bit differently. So I know that's a very large topic that we could probably talk for the next hour or so on, but we'll kind of try to just get some opinions on.
So it is a large topic. I'm grateful for being able to address this, because this is something that can cause some discomfort in the decision making, especially for those that are like, they could have swung to one side and like, no, now I have to follow this. And now you're asking me to kind of swing back over to the side, and that can cause some tension. And when I say that, it's because what we talked about before is different materials, because anything you put in the mouth is going to be a material, and it's not food. And it's not even like the chewing stick that you can use instead of a toothbrush now. So you're looking at introducing something that is not natural to the body.
For sure.
And for some, I'm really quite impressed with how they are doing all their own gardening, cooking all of their own food. And then here we are talking about introducing a metal into their mouth or a plastic into their mouth. With this, I want to let it be very well known, I am not a provider trained in things like the ALF appliance. Okay. So it'd be really interesting. I would love feedback from those that are. I have colleagues, friends that do provide that service. It's just not one that I've had to add to my repertoire of tools. So we're all going to have a different perspective. The most overall things that I can say in this short period of time is number one, the earlier you can treat, the more options you have to avoid some of the questions of, should you turn fast or slow? Because you don't then have to have a fast or slow rapid palatal expander because you're treating young enough.
Yeah.
The concern is that oftentimes we don't get them young enough. I can start to see concerns in infancy. So the youngest I've seen in my office is 2 weeks old to help direct that care.
Wow.
Most of the time, by the time you get to an orthodontist or an office that's providing orthodontic care, that window of being able to use like a prefabricated appliance. And when we say prefab, it's not custom made for your child. So if it's the Myo Munchie, the Myo Brace, the products that Vivo offers, those can have a better impact when you have such incredible growth and plasticity of the child.
Absolutely.
So there are ways to prevent. Just with this, we're hoping that people recognize it younger. So understand, if you want to have the least invasive, you start the youngest.
Yeah.
But with that, I try to remind my parents, whatever age you're starting at with your child,
You're here
is
now.
the right age.
Yeah. You're showing up and you're ready to make that change now too.
Yeah.
Yeah. That's
Because if
important.
there are always things that we're introduced to, and it's just not the right time. This is the right time. So yeah, if they are 12 and they have all their permanent teeth, this is still the right time for that child.
Yeah.
Because the child couldn't, or the whole family dynamic couldn't have supported the option at 3 when you were dealing with other concerns at 3. So with that, many of the products that are prefab products are more silicone based, medical grade silicone. So the concern about plastics is lessened with once they understand that difference. When it comes to when you have an appliance that's metal in the mouth, the long-term benefit versus the short-term. Now, with some appliances like the ALF appliance, that can be in there longer, but it can be taken out versus one of the standard expander types. When we talk about expander type, it has like rings around the teeth, kind of like on your hand, and it sets up there. It stays in there. That's in there for less than a year typically. So you have to look at the long-term benefit. Yes, there are some concerns of what it's cemented with. There's not a perfect adhesive for keeping that in place. Knowing that then, yeah, there are other things that you might have to ramp up. Whatever your child needs to help balance the child out themselves. But for less than 1 year, and sometimes, especially if you are more open to a lot of craniosacral therapy, there are so many other things that can help that go by so much faster.
Balance out any sort of concerns that a parent have. Yeah, absolutely.
And you express those concerns, and then you can change it. The reason why it has to, the reason why it typically stays in there longer, where they are with their myofunctional therapy. Myofunctional therapy typically isn't done while you're in the expander, but if you can't get your lips together and you're not using your nose, then I know if I take that out, the patient's gonna be struggling that much more to then be able to get the tongue up there. So again, there is some issues with timing, but then if I have a patient that they are routinely seeing their supportive care, then it doesn't have to be in there longer. The reason why I'm keeping that in there longer is because I need a way to let that bone remodel. If I have the tongue up there helping support it, I'm not as concerned.
Right.
It might seem like a very vague
No, I think
answer.
I understand. And I think it's still helpful to hear, because I think you mentioned before allowing the body to be the healer, and that's what we're looking for. So if a kind of quote unquote more invasive solution is recommended, then you have to look at what else you can do to support the body to get through that. And the amount of time that the exposure is there to any of these materials versus the overarching benefits of breathing better and sleeping better, that the benefit seems to outweigh any sort of short-term exposure to things from what we've seen. Is that correct?
Yes.
Perfect. I think we're very aligned on that topic. So I think that's just important for parents to hear. And obviously, if we've somehow confused anyone, both Dr. Murphy and I make ourselves available to have one-on-one consultations with parents and answer their questions. So if someone's looking for a more specific answer, we can dive into. I think that that's helpful to hear for sure.
Oh, good.
And then kind of a side question. Do you still feel like there's a time and place for, and this is a little technical, when kids used to lose a tooth, a lot of times the solution was a single band and loop that would hold the space tooth. Do you feel like there's still a time and place for that? Or are you seeing that in a lot of those cases, looking at the whole versus that one space? I'm just curious your thoughts.
Well, that's really good because we haven't actually had this discussion before, Dr. Julia. I am big into there's a time and space for almost everything.
Okay.
What I would say is the reason why the child needs a band and loop is what needs to be looked at. And there are times that discussion can get started, but they weren't prepared, like, oh, my child is losing a tooth early. And now you're saying it's because they're mouth breathing, what they're eating. I shouldn't eat cereal. My child's on a tablet too much. My child needs to get outside more. Like, what are you telling me? Like, they lost their tooth early.
Right.
But many times the reason why the tooth was lost early was because of extensive cavity. There are other times there could be trauma. There's all these different things. But what we're looking at is trying to keep the arch width so there's enough room for that permanent tooth to come in. However, many times when that band and loop is needed, so that appliance that is going to maintain that space for the tooth that has to be taken out, you're maintaining something that still it's not wide enough. So you're maintaining something that isn't really giving that job. It's maintaining a already smaller space.
You were saying it's sort of preventing a problem from getting worse, but we have to look at kind of, is there a greater problem going on?
Yes. And understanding that I had this issue where then I would then want to just give all this information to the parent. And it's too much to handle at that one time. Okay, so let's just break it down like, oh, so can you start to just write down some of the things that the child is eating? And if the child really likes cereal, and this is also a whole lot of, I might be getting some people a little bit like, wait, what cereal? Like, no, my kids do not eat cereal. I did not eat cereal. It was something I was brought up with, and I ate plenty of cereal in dental school residency up until probably 20 years ago.
For sure.
But when you talk about this, especially when it's dry cereal, like dry Cheerios is a huge snack for our littles. Like just having the parents switch their awareness and looking at things in a different way before they are given way too much that they can't handle.
Yeah.
So yes, let's maintain that space, even if it's maintaining the somewhat problematic spacing. At least it's going to keep some of it. And then especially, that's why I love practices of the primary care dentist having an airway focus orthodontic department as well, because then you're going to see them. You're going to see that pediatric patient back for cleanings and exams. You're going to see the caregivers that are bringing in many times, right? If you're seeing kids and adults in the practice, you're seeing them for that education a little bit more at each time. So it's not overwhelming, giving them resources such as, oh, so here, listen to some of the things that Dr. Julia has put out, follow her posts, find what's interesting, just being able to follow someone and changing your algorithm because parents, and I didn't even mean to say this, but I'm going to tell you one of my biggest secrets,
Yeah.
that just changing your algorithm by going through, and if you're on, Laura's Wellness Instagram, look at who she's following, go follow some of the ones that resonate with you. Your algorithm suddenly will be changing so that you get supportive content,
Yeah.
educational content, rather than content that is trying to, I should be saying a nicer term, but manipulate parents into acting out of fear.
Mm-hmm.
Or like, oh, of course this is good for your kid. And you don't have time and you don't look at the label and you're like, oh man, I didn't realize, because it told me it was good. Because I'm still there. I mean, we're not a perfect family
Oh,
with it comes
absolutely.
to eating, but I now can better see when the advertising, and even there's even educational things out there that make it look like it's educational, but they're really trying to put a parent into fear mode of you have to take action right now.
Yeah.
So if anyone says you have to do it right now, before you leave, you better sign that you're doing this.
Yeah.
Take a breath, take 3 breaths. And does that feel to you? Because again, there can be acute traumas that you didn't even realize were acute traumas that you had to deal with. Okay. This is more in regards to like babies, right?
Yeah.
But otherwise, take 3 breaths and feel if that's right for you. Or if this is something that, why can't I go home and think about this for a moment?
Absolutely. Yeah, I think that's a common, unfortunately, a common position parents find themselves in, is like, the doctor said my child isn't breathing. Like, is my child suffering brain damage? Right? Like, it escalates quickly into kind of this, there's already fear, there's already a lot of emotions that are needing to be unpacked. And as you mentioned, it can be overwhelming. And I personally know that myself, sitting chairside as a general dentist, I had a tendency to just blah, 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 blah. Like, let me tell you exactly who you need to go see and all these problems you need to tackle. And then 6 months later, the family would be back and I would be like, wait a minute, I thought we talked about this, And I was guilty of not really stopping to meet the family where they were at and opening up that dialogue to meet them on a pace and gradual steps that can help get someone to make progress, because that's what it is. Oh, look at you with your REMplenish. Little
Yes,
Myo
I
novel promotion.
got 2 different things here because
There
this
you
one doesn't quite have
go.
enough water in it.
Good tool for promoting good oral posture. And okay, so yeah, any sort of special populations and any sort of considerations that you might find just from your own experience that parents who might say, well, this is my child's specific experience, and one example might be autism. Like, what would you do differently to support families that may have a unique condition?
That's a great question, and one that I'm going to tread kind of lightly, because I very much have noticed the difference in caregivers when they're told, oh, this is going to work great, right? Or it doesn't work so good in this population. Whereas there can be data for different things, but none of that data is about your child, like your specific child, unless your child's in the case. Can you tell my 7.5-year-old?
If you participated in the research, then it is about your child. But yes, otherwise,
he tests me on everything. Like the last day of school was a half day, and they had a sign up saying, "Oh, happy last day of school." He's like, "It's the half day." You're right. I could have been very clear and put half day of school. So I found I really need to say, yes, if your child is part of the study, then it's for your child. Because so much of it actually has to do with the mindset of the caregiver that is routinely the one that goes with the child, but then also the support system around that. So no matter who it is, if it is the sitter that helps, if there's a partner in the household, families, because this is a lifestyle change for your child, but more important for you. And that is where there's a little bit even more unpacking, and where I'm going to tell you a little bit more from the parent point of view than the provider right now, is that as the parent now, that again, so my son is now 7.5, 7 3/4. And I wasn't strong enough to make the changes for myself. There were many opportunities in my life where I was running into a brick wall with my health. I was probably 25, I think, at the age when I was the most unhealthy. And things came up where I could have had the opportunity to transform to a different mindset then, but I wasn't ready. But when it came to my son, then I'm like, oh gosh, I'm not going to let this happen to my child. And then I realized, oh, but I've let this happen to me. I've been shamed. I've allowed fear to be put on me to make my choices. And okay, so this actually has to stop with me. I have to stop allowing this to happen to me if I want to be able to show this to my child, now children. So dealing with all the things that come up as a parent, oh my goodness. Yeah, that was talked to me, and I couldn't really hear it at the time. And letting it go. Letting that go, and knowing you've done the best for yourself and your child that you can, and being open to letting all that past go, forgiving yourself and the providers, because this comes up a lot too, but I trusted those providers. They did the best that they could for you. And the other aspect that comes up, and I really like to speak on this, is that oftentimes when we can allow ourselves to get really quiet, we realize our intuition was kind of poking at us when we were making certain decisions. And to know that, oh shoot, I really could have listened. I could have made a different choice. Because it's easier just to blame it on anyone else. Like, oh, well, my spouse wouldn't have let me do that. And really being okay that we all make mistakes, and our intuition is not something that most of our society wants to support us tapping into, especially as moms.
Yeah.
Because it's so incredibly powerful. So as far as populations, I will say the best population for treatment is those that the child is understood that the child has so much power. I mean, this little being, no matter how old they are, they're still your little child. And the more we teach them to be in tune, because they can tell us, ask them questions, and the terminology isn't always great for when you're talking with a child, depending on how you're trained. So ask the questions as simple as you can and hear them back, and understand that depending on their age, their answer might be what they saw on Bluey. I don't know.
Right.
But ask them the questions, let them know that they have responsibility with this.
With embarking on a dental treatment?
With this lifestyle change, because again, it's not just the parent advocating. The child has to kind of be respected, that they can tell when they're feeling better. Right? So
that their voice matters.
Yes.
Okay.
And that we believe them. We, again, depending on the age, depending on what they're going through, you know your child best. But trusting that they know the difference in how they're feeling, and trusting that they ultimately, like, their body wants to heal and wants to feel better. So that's gonna be the best outcome. You get everyone to know that this isn't something that just Dr. Julia is doing for me. It's not her work. It is your response to this guidance, and that it's a lifestyle change for everyone. Because if you only tell that child, oh, well, if they find don't eat gluten, you're sitting there eating a donut in front of them,
Right.
or their supportive community around them
Yeah.
brings donuts for everybody else, but says, no, you're in this, you can't. It's this disconnect. And not saying that there's so many caveats, right? But supporting that this is a change, that you're going to find what works best for everyone in the household. Yeah, I could talk more about it, but then it might get a little bit more confusing. But I will say that the best population is those that advocate for themselves as an adult and then advocate for their child. There's also the supplemental form. Oh, wasn't that funny?
Well, that's okay. We don't need to see it. You can tell us about it.
That I'm really proud of my AAO. So the AAO really isn't in alignment yet with some of these modalities.
Just to clarify,
right?
American Academy of Orthodontics?
Yes.
Okay.
So the residency programs talk about mouth breathing, adenoid facies, expansion, but it's that mindset that we're talking about. And that's different, but just to let you know, the AAO, like that is, we as orthodontists are taught this. It's just the view of it. But they did come out with the Supplemental Orthodontic History Questionnaire back in 2018.
Okay.
And I encourage every office to have something like this. I kind of just incorporate it into how I talk with parents, but it's really great if you can have the first point of contact ask these questions. The number one question here is, could you tell us about the condition your child had and how it affects behavior? Because it says, the intro is, would you please help us understand more about this condition and how it might affect your child in a dental or orthodontic setting? Because it starts off with your health history has identified your child with blank. So that leaves it very open-ended. Your child has been identified with, you can just say, poor sleeping.
Fill in the
So
blank.
how has this affected things? Please describe significant fears or anxiety that your child may experience during visits to healthcare professionals, including dentists. Has anxiety or fear prevented any necessary treatment? Are there strategies to help your child open up to new experiences, such as a visit to a new doctor? Examples: show and tell, humor, going very slowly, modeling with parent or sibling. Other examples: are there any physical disabilities that need to be taken into consideration, such as difficulty with fine motor skills? How does your child deal with physical discomfort? Are there learning disabilities that need to be taken into consideration, such as auditory processing, sensory integration, speech and language difficulties, and any information that might help us provide a positive experience for your child?
I love that. I did not know that form existed. I think, yeah, you're right. That opens up to really parents identifying what their own experience has been and what they've observed with a broad spectrum of situations. And I think that's one of the things that often is kind of commented about. The orthodontics are not, the programs are not set up to necessarily support younger children, because that wasn't historically how it was done. So whether someone's dealing with a certain condition, or if they're just younger and there's fear involved, fear can come from anywhere. So that doesn't have to be a condition. That's just a reality of some children's experience. So I love knowing that form exists. I think that's really helpful. And thank you for sharing that. Hopefully, if there are any providers listening, they can incorporate that form.
Yeah. Reach out to me. I'm really proud. As I started this off, I'm really a huge fan of organized dentistry. What does that mean to you as a parent? That means that dentists that want to have this profession continue to grow and better support their patients by supporting each other need to collaborate and have a voice. And so organized dentistry gives us a collective voice. So I'm really big into that. It's hard. And anytime you have something big, it's like the Titanic, when you try to shift it to move away from the iceberg.
Right.
It's sometimes a hard thing to shift, but to know that this was in 2018.
Yeah.
So things are evolving, because this takes years anything that is then
For,
out and
for
has the stamp.
institutional change. Yeah, absolutely. Absolutely.
So
For
this
sure.
form took years to create, I'm
Mhm.
sure, and that it's out and available. And I thought very well done.
Mhm.
Because I do come back and like support my orthodontist because so many just haven't had that personal experience yet.
Mhm.
Once they do, they have joined me in evolving our specialty,
Yeah.
and it takes that letting go, and it will happen when it's supposed to happen for each. But as an organization, it is starting to shift.
You're seeing the
And
momentum.
yes. And I will
Mhm.
say, just like we've talked about throughout this whole discussion, oftentimes when a child or any patient is brought to the orthodontic office,
Mhm.
so many other providers have missed the underlying cause.
Mhm.
And no one historically has gone to an orthodontist saying, my child has a sleep problem, I want you to fix it.
Right.
They focus on the smile.
Mhm.
And oh, it's great that we can say, oh my gosh, yes, you have, these jaws are out of alignment.
How is your sleep? Let's talk about
How's your
that.
sleep? And now
Yeah.
I have other resources to send you to help you,
Mhm.
because for so many years, so many people haven't been looking.
Mhm.
But since people do look at their smiles,
Mhm.
so my specialty has a great impact that it can make.
Without a doubt.
But that's also then why when they are coming in with, yeah, my kid does have puffy gums, and it's to their primary care dentist. That's
Mhm.
what I love my primary care dentist then taking this on, because
Mhm.
they do come to you with questions that are more directly related
Mhm.
to mouth breathing,
Mhm.
right?
Mhm.
So they can make that connection sometimes a little bit faster. So I
Mhm.
just love anyone to help anyone with it, but to
And it,
help understand why the perspective of one office might be different from another office.
for sure. Perfect. Well, thank you so much for sharing all of your insight today. I hope that that at least provides some clarity for parents who are just looking for more answers. We're always
Mhm.
looking for more answers. So I really appreciate getting your perspective today. It's something that I don't take lightly. I know that you're a very busy professional and a busy mom, and you're doing amazing things. So thank you so much for joining me and sharing your insight.
Well, thank you so much. This has been a pleasure. And for those listening, Dr. Julie and I, we really are doing this. Like, we've spent this, we met around noon to talk a little bit beforehand. So this hour and a half, because we want to serve. So please leave comments if this is, I don't know where this is going to be housed, if it's going to be on YouTube, but let us know, reach out to us, because we want to know this is being heard. And we'd like to, if you have questions, or so we'd like positive feedback, right? But also if you have any kind of constructive feedback, we would like to know, because that's why we're here. Otherwise, we both have things that we could be doing.
That's how we
And
get curious about
yes.
finding more answers ourselves, and being
Yes.
able to better support all of the parents too. Absolutely.
So let us know if this is on YouTube, drop comments, either way, and just connect with us. Share this with other people, not because of what we can offer to both parents and professionals, but because this needs to get out. This conversation needs to have more people listening and being a part of it, and that's what then will help your child, because the more people that understand this, the less friction there is between simply what's offered at the end of my son's soccer game. Those kind of snacks and those little things, of the less friction, we can have more joy and harmony in our lives. So let's start this again. We've done this out of wanting to share. So please share.
Thank you. Perfect.